gotten to see a lot of growth over the 15 years that I've been here. We've recently gone through some expansion in the health center where... When I first started here, there was one nurse, there was no doctors, it was a very small team, and we've grown to, 30 people just in this building. Accreditation helps us do that. It's the bones that makes us a successful organization.
The patients understand that. They know that their information is protected, that we are looking after their best interests.
Running a safe, successful organization is the hard work. Accreditation is just a resource that helps us do that.
Through accreditation, we've sort of made connections from coast to coast. It really is a group of camaraderie, in terms of communities across the country.
Seabird Island Health Centre is a hub. There's about 5 to 7 communities that use our services.
We have the dentist here, doctors, we have nurses, we have diabetic clinics. We're quite busy.
I think you have to destigmatize what accreditation is, because everyone thinks it's a punishment. And the way we approached it was, it's not a punishment, it's reinforcement.
My boss would always say, accreditation is quality assurance. It just brings a person's job up to a next level.
It's also a way to recognize staff that they are doing a good job.
Battle River Treaty 6 Health Centre has a long history that's focused on the people that we serve. That guides every decision that we make.
We've worked really hard to become accredited since the 90s, and we were the first First Nation owned and operated health center to be accredited in Canada.
The standards of accreditation are continually guiding our day-to-day practice. We deal with people who are often in their most vulnerable times, and accreditation has allowed us to know that when we're creating programming, we are providing best practice.
I think when you open the book of standards and you look at it, you think, wow, there's a lot here, but it's actually embedded in everything you do every day. Washing your hands properly. Like, guys, this is accreditation, and they're always kind of blown away like, wow, really?
When you're doing it for the first time, it seems like it's a lot.
But the further you get into it, you're realizing that we're already doing these. We just didn't realize that they were standards of accreditation at the time.
If you break it down, you take it piece by piece, it's a lot easier.
The more I get into it, the more I realize that being accredited means I can go home at the end of the day knowing that we've done everything we can to give best care.
I want to keep it conversational, so if questions come up, just ask me. It's intended to be a little bit of fun and kind of bring accreditation in a realistic sort of setting, so I've incorporated a couple.
So our survey is in 3 months' time. We'll be the first ones in the country to do the new standards. I started here, I was the only nurse here. Over the years, we slowly grew, and we're up to 25 staff here now. So we have a collaborative practice with doctors, nurses, NPs, dietitians, social workers, and that's why everybody needs to be involved in accreditation. It is a bit of work, but it's a good bit of work.
You're going to be the surveyors this afternoon, and you're going to walk around and you're going to do a little bit of investigation and see if there's any areas for improvement. It's a fun way to sort of put yourself in the mindset of an actual accreditation surveyor.
It is kind of daunting knowing that somebody's coming and going to ask questions. There's always a little bit of a stress level with that.
I feel a little anxious, am I going to give the right information?
They need to understand what they're doing and how they're doing and why they're doing it.
Yes, right.
We were making sure that everything was up to date, and a lot of things that we thought weren't done were already done. All the prep, I think it shows that you are invested in your work and that you're providing your community with the best care and you're listening to their needs.
It's not just a process to have a check mark. It's about the community in the end.
It means, you know, we have top-of-the-line services here at the health center to provide for the community.
We have to always remember we're a guest in the community and we help wherever we can.
She's always been pushing for betterness, you know. She wants to see this community thrive.
I think the most meaningful part is to see people coming to the health center and leaving satisfied and happy that they got the service they wanted.
Any health center that's providing service to a community should go through the process.
Like, just try it. You know, just open a standard, look at it and say, I think we can do this, you know. If you're doing good work for your community, half the battle's already there.
A lot of the standards, when you look at them, they are really based on doing the right thing. You know, most of it comes naturally. They're aligned with our human nature.
It is a journey of working towards excellence. It's about becoming part of a network, how to enhance their programs and services.
Every proposal we write, we put that we're accredited, and that goes a long way because they know there's standards that are being followed.
Don't be afraid to ask questions. I had a lot of questions for Accreditation Canada and they answered them.
They're just a phone call away. It doesn't cost anything to talk on the phone or email.
Accreditation is a foundation for a good, well-run organization.
What my health director told me was being accredited helps you sleep at night because you know you're doing a great job.